And good afternoon, everyone. Thank you for joining. As most of you may already know me, I see some new faces, so I kind of just want to reintroduce myself. My name is Prepoll. I'm an outreach coordinator at Cancer Support Community Central New Jersey. On behalf of Cancer Support Community Central New Jersey and Robert Wood Johnson University Hospital Somerset, we're happy to welcome you to the last session of Chronic Disease Series for the Black and Brown community, sponsored by the Far Hills Race Meeting Association and Robert Wood Johnson University Hospital Somerset Community Health Partnership. During today's Building Trust with Your Healthcare Provider session, we'll be defining what trust means to us, how to build a trusting relationship with your healthcare provider, and how trust or mistrust can impact health outcomes. Our presenter today is Dr. Melissa Richardson, a family nurse practitioner and a nurse manager at Robert Wood Johnson University Hospital, Somerset Family Practice. Thank you again for joining us, and I will hand it over to Dr. Richardson.
Thank you so much, Harel. I appreciate that. And welcome, everyone. I'm happy that you are joining us today. This is a timely topic. And definitely a topic that is vast with many layers. And so we will not be able to cover everything. Some things you're going to think about after we're done, with this session. But I do hope that it gives you some information and some groundwork, some things to think about, for yourself, and something that will help you and help your family. I'd like to let you know that I am an employee of Robert Wood Johnson Barnabas Health. I work with the Family Medicine Residency Program. I've been here for almost 14 years. And I am also a former client of the Cancer Support Community of Central New Jersey. So I just wanted to let you know that. And another thing I'd like to share with you. It is my purpose and my gift that I am a servant. What I do is I serve people in many ways and in many capacities. And it's my pleasure that I am able to serve you today by going through this presentation. And so please, jot down questions. And if there's a slide or information that I am sharing that you need clarification on, I definitely will be leaving time at the end of the presentation so that you are able to, ask your questions and get clarity. And so as Harel said, at the conclusion of the presentation, my hope is that you'll be able to define trust, not according to my words, but according to your own words. That you will be able to list 3 characteristics of a trusting relationship, and that you'll be able to state 2 ways that trust or mistrust can impact health outcomes. So, Harel, will you be doing the pre-poll?
Yep.
Okay.
Yep, so I'm going to launch the pre-presentation poll regarding building trust. So if you guys can answer, if you can, on your end, please do so now. We will reveal the answers towards the end of the presentation. We have a few people that just hopped on, so I'm just going to give them a couple of seconds as well. For those that just came on, we're doing a poll. If you could see it, please answer. Otherwise, we'll do it again at the end as well. And we'll compare the answers. So we have most of the people that answered. I'm just going to share results of this just to see just so you could see, Dr. Richardson, of what people said. So majority said true for the first one, as well as second one and the third one. And so we'll check again.
Okay, and thank you, thank you. Okay, so first things to consider. We're talking today about building a relationship. And so if you are building a home, you would first count the cost. You would first think about, what materials you need and how much it will cost you. Because it's difficult to build something if you don't understand what you're building and if you don't have the materials. So let's start off with talking about trust and what is trust. And this is trust, just a dictionary definition. Belief in the reliability, truth, ability, capacity, or strength of something. It can also be confidence, faith, or hope in someone or something, or confidence in the honesty or integrity of a person or a thing. And now when you think of trust and what trust is to you, you may find that you use some of these words, or you might have some additional definition or additional words that you use. But reliability, ability, confidence, faith, honesty, integrity are integral, are very important when it comes to trust. Some words that come to mind when talking about building a trusting relationship. One of the largest words on this slide is partnership. And we're going to talk about partnership because that is what it is. It is a working together. Other words on this slide, you see respect, listening, quality, empowered, sharing, communication, and many others. These are things we think about when we think about trust. And it doesn't matter which relationship we're really referring to. It could be trust among friends. It could be trust among colleagues. It could be trust in family. But today we're talking about trust with the healthcare provider. Now, trust is something that we develop as human beings. As early as 18 months, we're developing trust versus mistrust. And so we learn based on the needs that are met or the needs that are not met. We either learn to trust or mistrust. We have suspicion or anxiety if trust is not developed, if our needs are not met consistently. If care has been inconsistent, unpredictable, or unreliable, then an infant may develop a sense of mistrust, suspicion, or anxiety. And this is something that is carried through our lifetime as human beings. So examples of trust. Now we're talking about building a relationship, but we trust a lot of things and we see trust in many ways. An example, you may not know this woman. This is Michelle Obama. She trusts that that chair will hold her up. Before she sat down and looked at that chair, she said, this chair is going to be able to hold me. That's an example of trust. This woman, you may not recognize her. She's Mayor Cruz, mayor of Puerto Rico. During the disaster in Puerto Rico, she went around to neighborhoods to provide aid and care for the men and women and children who live in Puerto Rico. She trusted when she sat on that truck and when she got on that van, that it would be able to carry her from community to community to provide care for the people that she serves. And lastly, this is a picture of two Native women, Native American women. The woman to my left in the white jacket is a healthcare provider. And the woman sitting on the exam table, she's a patient. And that patient went into that provider on that day trusting that her cares, her concerns could be met. So just examples of trust. Now, what are some characteristics of a trusting relationship? Well, we have transparency. What is transparency? We're going to go into that. We also have respect, understanding, speaking up, and time. Now, these are not the only characteristics of a trusting relationship, but these are a few. So let's talk a little bit about transparency. That's sharing your history, your thoughts, your feelings, your fears, honestly, without fear of judgment or negative consequence. And let's talk about that a little bit. Transparency. It's not easy to do. When you look at that definition, we're talking about sharing a piece of you with someone who you do not know, and you're trusting that they are not going to judge you. You're trusting that they're going to take that information about you and take care of that information. And that is not easy to do, but that is an important part of trust, being transparent. I'll give you an example. I'll give you two examples. It may not be easy for a woman at a visit to share with her healthcare provider that she's a widow. That might be very difficult for her. But that piece of information can be very important to the healthcare provider. And you may say, how? Why would that be important? Well, a widow could be possibly male or female, may have some difficulty with finances, with their partner gone. Could they have food insecurity, meaning not enough food to eat? There can be some emotional and social issues that may need to be addressed. So just knowing that one piece of information is important to the healthcare provider. Another example of transparency, and this is another female example. It might not be easy for a woman to share. Actually, let me restate that. This issue is a human issue, male and female. It might not be easy for an individual to share with the healthcare provider that they've been abused, physically, mentally, emotionally. That's a very difficult piece of history to share, but that could be very important. So transparency is one characteristic. And let's talk about respect. Respect is the recognition that an individual has valuable and important contributions to make in a relationship. It also is regard for feelings, wishes, rights, or traditions of others. Respect is very important to human beings. It is hard, difficult to establish trust with someone who you believe does not respect you. And so respect is an important part of trust. And respect is, you want it to be felt. In other words, when you're sharing with your healthcare provider, you want to have the feeling that this individual respects me as a human being, and that they are not judging me as a human being. You're more apt to open up and share. And it is important for the healthcare provider to respect all of their patients. It is a two-way street. And so we're going to go on to understanding how important it is to understand. It is to know by experience, or to interpret, or to receive ideas expressed to comprehend. It is to know the meaning of everything intended. When a patient shares with the healthcare provider their history, their fears, their concerns, they want to be understood. They don't want to be judged. And it is important for the healthcare provider to understand and to seek understanding and to have a conversation and interaction as long as it takes to make sure that there's understanding, because understanding is needed before you can move forward to treatment, to care. You have to know and understand an individual. And something I want to share, this series has been for the Black and Brown community. And we are very varied. And part of understanding is knowing that I am a Black woman, but that doesn't mean that when I have a Black woman sitting across from me in the exam room, that I understand her. I seek to understand her. I allow her to share information with me to make sure that I fully know who she is. And then there's speaking up. Speaking up is important, and it is not easy. It is not easy for patients to speak up with the healthcare provider. There's a relationship there where sometimes patients feel that the healthcare provider is in charge. They are the boss. But I'd like to challenge that. I'd like to say that the patient is in charge, that the patient is the boss. In actuality, as a nurse practitioner, I work for my patients. I provide a service for them. They are in charge. I partner with them. And I encourage them to speak up. And so if you are comfortable with speaking up, that is great. And so you want to share your feelings and your opinions honestly and freely. You want to speak clearly to your healthcare provider to let them know what your needs are. If you're not too comfortable speaking up, it's important for the healthcare provider to provide a safe space for you to do so, to encourage you to speak up and help you do so until you're able to just do it without prompting. But speaking up is important because in building this trusting relationship, the trust and the relationship is built on knowing what the patient's needs are. And it's the patient who knows the patient best. And then there's time. You need time. Trust is not something that is developed in one visit, in 2 visits, in 3 visits. You can begin to develop it, but it is not something that is developed in a short period of time. So you take your time. It's like building a home. Every home needs a foundation. The foundation might be built with cinder blocks or bricks or cement, but you take one block, one by one, and you stack it, and you use the mortar, and you just take your time building it. It's worth it. But you need time to build a trusting relationship. And the trust actually begins with the first phone call. You trust that the office you're calling has what you need, has a provider there, a healthcare provider that can help partner with you on your healthcare journey. So we talked about transparency. We talked about respect. We talked about understanding, speaking up, and time. These are some characteristics of building a trusting relationship. So now it's time to build. And if you look at this illustration, there are more than just two people. It's not just the patient, and it's not just, say, the physician or the nurse practitioner or the physician assistant or the respiratory therapist or the physical therapist. There are a few other people there building, because you can't forget the nurse or the medical assistant and the receptionist and the medical transport, the phlebotomist. There are many people who are involved in care, and they're taking these pieces one by one and connecting them until they get all the way over to the round circle there where it says trust. Also, I want to point out, building takes effort. It is not a passive activity. It is an active activity. As the patient, the client, the customer, you have a job to do. But also, as a healthcare provider, the doctor, the nurse practitioner, the physician assistant, we have a job to do. And together we work toward building that relationship. So time to build. What do you do? How do you choose that healthcare provider for yourself? I said primary healthcare provider because I happen to be a primary healthcare provider, but it could be cardiology. It could be a specialty. In our case, we're talking to some individuals today who either have cancer or they're caring for someone who has cancer. And so how do you choose that healthcare provider? When you have cancer, you have a large team. You have your primary care provider, you have your oncologist, you have your hematologist. There's just so many providers who partner with you to take care of you and to help you figure out the plan that is best for you. So first is choosing that healthcare provider who works best for you. Some people prefer nurse practitioners, some physician assistants. There's no right or wrong answer. You make that decision. And so also choosing, do you go to a clinic, a physician office, or urgent care center? Sometimes the decision is not left up to you because insurance does play a part. But where you can, you want to pick the environment that you're most comfortable. When you're comfortable, when you're relaxed, it's a little easier to begin that process of building trust. Now, if it's your first visit, when do you start building that trust? What do you do? I would encourage you, before you even have your first visit, when you're calling to make your appointment, ask questions about expectations. What can I expect when I come to your office? The more questions you ask, the more answers that you have, the more you know what to expect, you're a little bit more relaxed. Again, a little easier to build trust, to begin that process. You also want to, I would encourage you to, write down what's important to you. Write down your fears. Write down your needs, your wants. Now, it doesn't necessarily mean that at the first visit, you're going to be able to tackle all of that, to cover all of that. But if you jot it down, if you know yourself, then you can begin to, and I would encourage you, start with the most important thing and then work your way through your list. You don't want to leave your appointment with any questions. You don't want to leave with any questions or being confused. Now that can be challenging because visits can be rather short. Again, start with the most important questions, and let your healthcare provider know, I have a few questions. And my expectation is by the time we're done with this visit, that I have an opportunity to address 2 or 3 of my questions. Setting the expectation does help. There are times when maybe the healthcare provider is not able to answer all of your questions at one visit. But the fact that they are willing to go through those questions with you and talk with you until you understand is an indication to you that I'm in the right place. I can establish trust with this individual because they are willing to listen. They are willing to hear me. They are willing to they're even asking me questions to make sure that they understand what my needs are. And you also want to know that you have the name and the number of your provider. How can I contact you once this fits fairly and justly and kindly and with compassion? Knowing your biases helps you in that building that trusting relationship. And so forgive me, the slide on dangers of establishing a trusting relationship, the information is missing from that slide, but I'm going to speak to it. Now, I think that you may have an idea for yourself what some dangers may be. Pardon me. But one of the dangers of not establishing a trusting relationship is either no communication or poor communication. No communication is very dangerous. In other words, if you don't feel comfortable talking with your healthcare provider, there are some things that you are not going to share with them. There are some things that you are not going to say. And that missing information can be very important. Or maybe there's something going on with you and you're just not comfortable sharing it with them because, again, you don't know whether or not they're going to judge you. But that could be very difficult. That could be very dangerous because that's information that the provider may need to know. What else is dangerous about not establishing a trusting relationship? Well, the timeliness of care. If you don't trust your healthcare provider, if you're unsure, you may not go for that treatment that they are recommending because you're not sure about them. Now, the treatment might be exactly what you need, but you're not sure. So you delay it or you just don't go. And that could affect your health outcome. Also, not establishing a trusting relationship is that there are things that you, as I said earlier, you will not share. There's a lack of confidence in exactly what is being told for you to do. You also may not interject. And what do I mean by that? Yes, your doctor, your nurse practitioner, your physician assistant, they're the healthcare provider. They may understand high blood pressure a little bit better than you do, your cancer diagnoses better than you do, but you know you. So when we as a healthcare provider are sharing with you what your diet should be, it's time for you to interject and let us know, I can't follow that diet plan, and let us know why. It might be because of food insecurity. I don't have enough food at home. I've been laid off because of COVID and things have been tight at home. It might be cultural. This is how we fix our food, and these are the seasonings that we use. I don't know another way to fix that dish, but food is important in families. And so again, like interjecting and sharing this information, then you can have a conversation. Okay, I can't do this part of the treatment plan, but I can do the other. I want you to go and walk. After dinner, I want you to walk at least 15 minutes. Well, after dinner, it's fall, it's getting dark. I can't walk in my neighborhood. It's not safe. As a healthcare provider, I might not know that because I don't know your neighborhood. As a patient, you know your neighborhood, you know your home, you know your needs. Share that information. But again, if you do not establish a trusting relationship, you might not share that your neighborhood is not a neighborhood that you can walk in at night. You might not share it because you may feel, well, this person's going to judge me. What are they going to think about me? What are they going to say? And so again, I hope you're seeing how these pieces come together in trust and building trust. Now, as I stated before, building this relationship is not on the patient. Building this relationship is not on the healthcare provider. Building this trusting relationship is on both. It's on every member of the team. As many members are a part of the team. It's everyone's responsibility. And in my opinion, the physician, the nurse practitioner, the physician assistant, the nurse, the respiratory therapist, the physical therapist, the oncologist, whoever is part of your team, they work for you, the patient. You are paying us to provide a service, and we work for you. And so I know there's a little bit of a hierarchy. The doctor's always right, or, you got to do what the nurse practitioner says. And I get that culture. That's the way we are here, especially in America. But maybe we need to change that dynamic a little bit, because if you have a partnership when it comes to your healthcare, there's a better chance that you're going to find the right thing for you, the right plan for you. And so also, though we're talking about diagnoses like cancer and hypertension and diabetes, some of us here on the line, we don't have any of those diagnoses. We are, for the most part, we're healthy. Well, prevention is important in healthcare. So how can you partner with a healthcare provider to help prevent illness, to help maintain good health? Or maybe you have a diagnosis of hypertension. Well, that can be reversed sometimes. Diabetes can be reversed sometimes. How can you partner with that individual to make that happen? And so this is a picture of a provider and a patient. And so I want you to look at that. I want you to look at these two. They are in the process of building a healthy, trusting relationship. The provider is seated. She's not standing ready to rush out of the room. The patient is sitting and his shoulders are relaxed. I'm not sure if you can see that, but his shoulders are relaxed. There's a smile on her face. She's not talking. She's listening. There are certain nonverbal actions that a provider can do to help the patient know, you can trust me. You can trust me with your story. You can trust me with your fears. You can trust me with your concerns. And so this is just one example of, what does it look like when you're building this trusting relationship? Building the trusting relationship takes all of us. It is a work in progress. It takes time. It takes honesty, transparency, respect. It takes understanding. It takes you speaking up for yourself. And when you can't do that, find an ally, a family member, someone in the office to help you speak up. But it can be done, and it is so, so well worth it. Thank you.
Hi, Dr. Richardson. It's Caitlin. We're going to now launch the post poll. So I'm doing that right now for everybody. It should be coming up on your screen shortly.
Great.
Thank you, everyone who's completing the poll. We're going to give everybody 10 more seconds, and then I will show the results, Dr. Richardson, so that you can go over it with everyone.
Great, great.
So here are the results.
Okay, good, good. So I see the results. So the first one is, it is the healthcare provider's responsibility to build the trusting relationship. And so we're almost split half and half here. And so I'm wondering if some of the participants are understanding the question that it is the responsibility of the healthcare provider. And then the ones who said false understand that, and it's also the patient's responsibility to develop that and build that relationship. I do want the participants to come away with the notion that it is a collaboration and a working together. And so the second one, if I do not trust a healthcare provider, I am less likely to follow the recommendations for care. And most of you said true. And research has shown that that does happen. Now, that's not 100%. So the couple of people who may have said, false, they're right. There are a few occasions when the individual will follow the directions, even if they don't trust the provider. But more often than not, there is a delay in care, there is a delay in treatment, which can be dangerous for the patient. And it takes time to establish trust with your healthcare provider, and so that is true, and everyone agrees with that. And it does take time, but it is absolutely worth it. And so I'd like to allow time now for the participants to ask questions if they have any.
I will also be launching an evaluation poll so that we can get your feedback on the entire series. So you'll be seeing this as well. And then Dr. Richardson, I can read you some of the questions that are in the chat so that you can discuss those questions as well.
Absolutely. And so do you want the participants to do the evaluation first?
Yeah, so we'll give them a few seconds. It's all multiple choice, so it shouldn't take more than a few seconds. And like I said, I'll give everybody a little bit of time to do that. And I do see that there are quite a few questions in the chat, so we can address those first. And then towards the end, if time allows, I guess people can unmute themselves to ask you specific questions as well.
Fantastic.
Thank you again, everyone, for completing the evaluation. It helps us here at Robert Wood Johnson University Hospital Somerset and Cancer Support Community of Central New Jersey find ways that we can best support you for upcoming programs. Once again, Dr. Richardson will give it another 10 seconds. Okay, everyone. So now, Dr. Richardson, if you're ready, I can start reading you questions that are in the chat.
Thank you.
Okay. So the first one is from Dorothy Rivers, and the question is, having been a caregiver for family members, what to do if the provider will not allow sufficient time to ask questions?
Okay, and that's a good question. if the healthcare provider consistently does not allow time for questions, I would recommend considering another healthcare provider. Firstly, I would be direct with the healthcare provider about the needs and the expectation that there are additional questions and that these questions are important to you and to the family member, to the patient primarily. And if they are not willing or not able to provide time to have those questions answered, I would have a conversation with the family member about possibly looking for a provider that might have a better fit, because fit is important. Also, additionally, sometimes speaking with the office manager can be helpful too, but I would first discuss it with that healthcare provider, letting them know what the expectation and the needs are and allowing them an opportunity to adjust. But if they're not able or willing to adjust, it's time to find another provider that will better suit the family and that the family member's patient's need.
Thank you, Dr. Richardson. So the next question is from Latanya Washington. What should you do when you feel like the provider is dismissing your concerns?
That's a good question. And so there are a couple of things that come to mind because that can be a little difficult. If this is someone who you see regularly, meaning you see this provider, you know this provider, you may not building the trusting relationship, maybe you're on the journey with that, but you know this person, they've known you for a year or more. I would be direct with them and say, when I share this concern with you about X, it feels to me that you're dismissing it, and this is important to me, and have a conversation. If it's someone that's brand new, you've not met them before, it's kind of a new, a new relationship, I still would say to the provider, I've shared this concern with you. I hear what you've said about it. I'm still concerned. I'd like to discuss a different approach. And if it's difficult being assertive, because it's not always easy being assertive, possibly have someone go to a visit with you to help you with that. Now that's a little challenging now with COVID, but you can FaceTime. But again, the healthcare provider works for the patient, not the other way around. And so that healthcare provider, I would be honest and I would say, I feel like you've dismissed this and this is very important to me. I'd like to discuss another strategy.
Thank you very much. We have another question. It's from Fatima Hargrove. And the question is, what are some of the challenges other than language and culture that prevent the building of partnerships?
Other than language and culture?
Yes, that prevent the building of partnerships.
Past experience. Sometimes the past experience of either a family member or the patient themselves and a negative, experience can get in the way of building the relationship in the present. This is an example, and this is a little bit extreme, but there are some patients who will say, no, I don't want to go to that hospital. Uncle Frank went to that hospital and never came out. Now, that might be the hospital you need to go to for your test. And Uncle Frank was maybe 99, and so his passing away may not have had anything to do with that hospital, or maybe it did, but it can get in the way of care. And again, like I said, that's a little bit of an extreme example, but past experience, negative past experience within the family or yourself can definitely be a barrier.
Thank you very much. So those are the questions that we had in the chat box. Mm-hmm. If anyone else has additional questions, we're near the end of the presentation. So feel free to unmute yourself and you can ask Dr. Richardson directly. So I'm not hearing any more questions.
This is Joyce Adams. Would it be possible to get a copy of these slides? I found the whole program very informative.
Thank you, Ms. Adams.
Would it be possible to get a copy of the slide?
Haral, are the participants able to get a copy of the slide deck?
As long as you're comfortable with me sharing, I could share it as a PDF file. But we were actually recording this presentation, and my internet dropped halfway through, and I'm back on. So we have two parts. We'll try to figure out and what we can get to you guys, but I apologize.
No worries. Yeah, I'll send you the slide deck. Yes, Ms. Adams, we would be more than happy to share that with you.
Thank you.
Awesome. Thank you so much. I think that's it. I don't know if there are any additional questions. Just remember to unmute yourselves.
Can you hear me?
Yes.
This is Dorothy. Okay, I wanted to just kind of make a comment. I think your last big question, what prevents building partnerships. Negative past experience is a big barrier, I think, for many minority people. And when I say past experiences, I go back to Tuskegee or Henrietta Lacks, those type of experience that a lot of minorities know about. So when you first go to the doctor, that's already in your mind. What's another way, do you think, to get over that past experience? Do you need to, do the provider, is there something the provider can say to that person to, you know, let them know? And when I'm asking this question, I'm thinking not somebody who's doing a regular routine chemo session. Their DCIS, which is normal, so you take your chemo. But I'm thinking about people who need to go a little bit further, and maybe the doctor is saying, we need to get you into a study, something like that. That negative past experience is very, very strong.
You're absolutely.
Is there any way
Go ahead and finish.
that a doctor could help a person through that past experience?
Right. And that's a very, very good question, because you're right. Things like the Tuskegee experiment, eugenics, the sterilization of minority women, women of color, definitely is something that is, you know, even to today, there's a recent story that's unfortunate that women have been sterilized and unnecessarily. So how do you get past that? How do you trust a system that has sometimes proven themselves to be untrustworthy? And so I don't have the answer, but what comes to my mind is when you're working with your healthcare provider, let's talk about your oncologist, you've established a relationship with that individual. If that individual has been able to vet a particular research study, say, and they say to you, Melissa, I really believe that this is something that could help you. I think only through conversation and have them show you the information, share it to you in layman's terms, because research is not always easy to understand. Exactly, you know, who is doing the study? What is the purpose of the study? I think the more information you have given to you and speaking with someone who you trust makes it a little easier for you to say, okay, I'm going to go ahead and I'm going to try that and see if that helps. But that's not an easy barrier to get over. It is not.
Mm-hmm. Okay, thank you.
Mm-hmm. And thank you for that last question, because there, as I said in beginning our conversation, this topic, we've just scratched the surface. There are just so, it's like an onion. There are a lot of layers,
So from Felix, thank you, Dr. Richardson, for this presentation. And then Lourdes said, thank you for the presentation. You're a blessing. The wisdom you shared with us, it's very valuable. And then I don't see any other questions or comments, but I think everybody found this presentation really helpful. If there are no additional questions or comments, we shall end the meeting. Thank you everyone for joining. I appreciate it. And I'm sorry for those that lost their connection. I know I did, and I'll try to get the information out to you as soon as I can.
All right. Well, thank you for having me. It was a blessing. Thank you so much.
Of course. Thank you for your time. Bye-bye.